Welcome to Praxian.com, the #1 cybersecurity consulting firm serving small and medium-sized businesses. Call us today for a free consultation. Top 5 things every hospital, doctor's office, and healthcare provider should do to secure their patient data and protect themselves from cyber attacks. Hospitals, doctor's offices, and healthcare providers have become a prime target for cybercriminals since the beginning of the COVID-19 pandemic. Compromised healthcare providers have been forced to cancel surgeries, examinations, and other critical health services because their systems, software, or networks were compromised or disabled. Healthcare systems sometimes are outdated and remain unpatched for many months or years, giving hackers easy access to systems and entry to networks. Risks to healthcare providers go beyond electronic protected health information, or EPHI, and may exist in everything from legacy systems, networks, and software. Whether the hackers get in through ransomware, phishing attacks, or credential harvesting, healthcare providers remain a prime target for hackers that are trying to monetize protected health information. The stats. Hospitals account for 31% of all data breaches, and 93% of data breaches are preventable with the right cybersecurity measures in place. Data breaches reported to the U.S. Department of Health and Human Services, or HHS, by healthcare organizations show that in the past 3 years, the number of patient data stolen from computer breaches has tripled to 45 million patients affected. And the average cost of a ransomware payment to an attacker by a doctor's office is $250,000. And the overall cost of an incident is $3.86 million when you add the cost of replacing technology, legal fees, higher insurance costs, cost of cyber incident responders, etc. Healthcare providers will remain a prime target for hackers for the following top 5 reasons. They are quick to pay ransoms because of the urgency of their operations. They typically have no or very limited cyber capabilities. They are less likely to follow cybersecurity best practices. Doctors' offices usually rely on legacy technology, and hospital networks typically contain a very large number of Internet of Things or IoT devices that are poorly configured. By the end of this video, you will have a clear understanding of the top 5 things doctors' offices can do today to protect themselves from cyber attacks. The goal of this video is to shed light on what healthcare providers can do to effectively manage their cybersecurity risks. Here are 5 things every healthcare provider should do to protect itself from cyber attacks. Number 1. Get professional help. You wouldn't advise your patient to deal with a healthcare issue themselves, and in the same vein, you shouldn't deal with a cybersecurity issue yourself. Get professional help. Identify and retain a cybersecurity company like Praxian, and at the very least, establish a relationship with us early. Ask us about performing annual cybersecurity checkups, providing healthcare threat briefings, annual incident response plan reviews, and tabletop exercises, or TTX, etc. All our professionals have the relevant experience, education, industry certifications such as CISSP and CISM, to name a couple. Number 2. Establish a culture of cybersecurity and train your employees. Take cybersecurity awareness training seriously and perform refresher courses at least annually. It only takes one employee to click on the wrong link to render your entire network vulnerable. At Praxian, we recommend getting specialized training relevant to your technology stack. The National Institute of Science and Technology, or NIST, provides free online cyber learning content. Additionally, the Department of Homeland Security, or DHS, Cybersecurity and Infrastructure Agency, or CISA, has information on the latest cybersecurity threats and mitigations for businesses on its website. Number 3. Plan for the unexpected and back up your data. When planning for the eventual breach, ask your team these questions. Do you know what you would do if a cyber attack occurred today? Does your practice have a cybersecurity incident response plan? Is your data backed up? And do you have a plan on how to continue hospital operation in the event of a breach to ensure no loss of life? Number 4. Have a cybersecurity strategy or plan. A cybersecurity strategy is a document that articulates what your hospital plans to do to standardize the protection of its data and networks. The document helps healthcare providers make rational cybersecurity decisions that are in line with their business strategy. The document identifies the hospital's key digital assets, lists roles and responsibilities of stakeholders, has contact information of all stakeholders including law enforcement, support vendors, contractors, etc. Having this document also shows your patients, business partners, and insurance company that you are serious about protecting your patient and other data. Number 5. Update, patch, and configure your IoT devices and software. A best practice is to keep your hardware, including IoT, software and systems updated. Update servers, mobile phones, tablets, laptops, and IoT devices. Where practical, upgrade to the latest version of software such as operating systems, antivirus, web browsers, Adobe, and other supporting software. Hackers are generally looking for flaws in systems, so fix them as soon as possible. Also, it helps to subscribe to manufacturer news bulletins for the latest security information. Join the conversation. In the comment section below, share what your office is doing to protect itself from cyber attacks. As a bonus for staying until the end of the video, use promo code 1PRX2022 to get 15% off any of our services today. Thanks so much for watching this video. Support us by subscribing to our channel. Stay safe. See you next time.